Struggling with hair loss? Learn how a hair transplant can be a game changer in your case. In this video, we are going to discuss a grade 6 male pattern baldness patient whose life was absolutely changed and transformed by undergoing a fantastic hair transplant at Saraswat Hospital, Agra. Also, in this video, we will discuss with you an application, an app which shows you or gives you a peek into the kind of result you can expect after your hair transplant. So this 27-year-old male patient came to us last year regarding his hair fall problem which he was having for around 15 years. We did his trichoscope. We found out that his donor site average thickness of hair was 0.073 millimeter, which is very good. His average density in the donor site was almost 80 or slightly more than that, 80 follicular unit per centimeter square in all the areas. This was again very good. His total donor area follicular unit were around 11,600 and he had a total donor area of around 145 centimeters square. So all these factors were going into his favor as being a very good donor site. His coverage value was also on the very high side, was 12.32. Then we analyzed his recipient area. He was a grade 6 male pattern baldness, so we agreed to cover from the mid-frontal point up to the transition zone in a single sitting of hair transplant. This area from the mid-frontal point up to the transition zone was 131 centimeters square, which we calculated precisely again in his case. We decided to go with the density of 35 follicular units per centimeter square. Thereby, in this case, he needed approximately 4,600 grafts. His average hairs per follicular unit was around 2.11. After this consultation, we did his blood test and then we fixed up a day for him. When he came on that day, the first thing we did was to check out his allergy or doing a sensitivity test where we check out if any patient is allergic to medicines which are being used during the hair transplant so as to minimize the risk. We did an ECG also for him. We gave him a shot of antibiotic to prevent infection. After this, we marked his hairline. So his hairline we marked at around 7 centimeter from the eyebrows, and then we marked his frontotemporal angle on the sides, and after doing laser marking we made the hairline irregular. After this, we gave local anesthesia, we made the sides as we do in every case. Then we started with the extraction. All the roots which were taken out, they were sorted out into 1, 2, 3, 4 hair grafts. On the screen here, you can see the 1, 2, 3, 4 hair follicular units, total number of grafts, average number of hairs per follicular unit in this particular case to get a scientific information about the follicular units used. After the insertion part was over, we did all the cleaning up, did a dressing at the donor site, gave him a detailed post-operative instruction sheets, gave him all the medicines which were required for pain and healing and all those things, and these all are included in the cost of the hair transplant. So it's a kit which we provide to our patient. We give all kind of other things also. Then he started coming at the regular interval. He came at 3 months, 5 months. Every time he was coming, like at 3 months we could start seeing some hairs coming out. Then at 5 months again when he came for the PRP, we could see that there is some filling up. Around 40 to 50% of the transplanted hairs had come out by 5 months. But when he came at 10 months, we could see that he had got a very good growth, which you can see in the before and after pictures on the screen. Also, you can see the combing video of his recipient as well as donor site, and you can see the kind of transformation he has achieved by this hair transplant. We request you to subscribe to our channel to keep on watching such informative and useful videos about hair loss and hair transplant. Now let us discuss the app which gives a peek into the kind of results you can expect. It is an artificial intelligence based app in which you have to download, fill up some basic information. After a feedback from our American board certified hair transplant surgeon, you get kind of result you can expect and the number of grafts and the questions which every patient should be asking their hair transplant doctors, especially about the planning and the involvement of the doctor in their hair transplant. This app is by the name of Saraswat Hospital and is available on both Android, Google Play Store and iOS, and the link for this app is given in the description below. In the end, I would request you to have some sort of takeaway message or points from this video about planning your hair transplant. So the request from my side is to check out the qualifications of the doctor with whom you are planning your hair transplant. And there are now NMC guidelines, National Medical Council guidelines about who can perform a hair transplant and where it should be performed. So it's a very detailed guideline. You can read about this. The link we will share in the description below also. Second is how much is the doctor himself or herself involved in the procedure. Number 3 is the planning, which has to be done by advanced tools which give you very scientific and accurate predictions about the results. Number 4 is the transparency of the procedure and the number of grafts which have been taken out, and this should be well displayed. Number 5 is about the tools which are being used during the hair transplant. So these are the takeaway home messages for you or takeaway points for you. If you are planning your hair transplant and you want it to be done from us, you can comment in the comment section below, or you can call at the number or WhatsApp us your details and our team will try to reach out to you. If you want to know some home remedies for hair loss, please click the video on the left, and if you want to see results of one of our hair transplant patients, you can click the video on the right. Thank you very much.